Hi, I'm Jessie Gruman, the president of the Center for Advancing Health. Healthcare is only one of many strategies we enlist in our efforts to live our lives free of suffering. The Center for Advancing Health, which I direct, just released a study that found that most of us actually do relatively little to participate in our healthcare. This snapshot of engagement focuses on Americans' participation in our healthcare. To benefit fully from the care available to us, we and our caregivers face a growing number of responsibilities to find safe, decent care and then to make good use of it. Healthcare reform has sparked many new efforts to improve the quality of care, many of which are directed to be patient-centered. It's important to institutionalize support for people's engagement in the policies, measures, and practices that are developed. Now, to assess where we are today, my center searched 31 national surveys sponsored by the government, private organizations, and foundations to locate data on the specific behaviors that each of us must do in order to benefit from our care. For example, I have to make sure that my medical information is conveyed to my various doctors and institutions. I have to question my doctor when the next steps I have to take are not clear to me. And I have to talk with my doctor about the recommended tests and treatments in order to make the right choice for me. For the vast majority of engagement behaviors like this, for which we found data, about 1/3 of us do them regularly, about 1/3 of us do them occasionally or sporadically, and 1/3 of us don't do them at all. When we looked across the surveys, some patterns emerged. More of us are willing to do simpler things like make a list of medications than complex ones like make a fully informed treatment decision. The depth of our participation in any engagement behavior tends to be shallow. For example, more of us seek out information about providers or health plans than actually use that information in order to make a choice. We appear to defer information and advice seeking until we have a specific need. Our participation takes place reactively instead of proactively. For any single behavior, those of us who are less likely to participate have less education, more marginal health literacy, lower incomes, we lack health insurance, and unsurprisingly, we tend to have more health problems. While such barriers affect many people, the lack of participation in healthcare is also common among those of us who face none of them. The healthcare reform bill that passed recently will increase our access to care, but without our active, knowledgeable participation from the insured and the newly insured, that reform will yield only sporadic improvements. While each of us, along with our caregivers and loved ones, must take on these responsibilities if we're to get the most from our care, we can't do so without the cooperation of every stakeholder in the healthcare enterprise. It's time to bring to the challenge of increasing Americans' participation in healthcare the same energy and commitment that have been devoted to increasing the access to care and improving its quality. My health, your health, my mom's health, your kids' health, my neighbor's health, our community's health, and the health of the nation depend on both our ability and our willingness to participate actively in our care.